And one of the things that happened to Dr. Upledger when he found that these bones were in fact moving, he went to do a presentation in Israel to a bunch of osteopaths and physicians, and they were not impressed so much because they learned anatomy from Spinoza, which is a different anatomy system, and in that system the bones are not fused. So the fact that we recognize that these bones aren't fused is an interesting thing. And in animals, the same thing is true. I asked my sister, who's a veterinarian, Dr. Judy Morgan, what she learned in vet school, and she said, we just had to label a bunch of parts. We didn't really look at anything more detailed than that. So that's where we need to learn about craniosacral therapy to understand what's going on with those bones. The bones of the head, the spine, and the sacrum are all interconnected structures. If I use another model here, this is the spinal cord, is the yellow rubber band, and it runs all the way down the animal to the sacrum, and then further down to the final vertebrae. So this whole system is connected, and we can have a huge impact on that with treatment with craniosacral therapy. Because that's all connected, any fall or injury to the coccyx or the sacrum or the tailbone can years later result in pain in the neck and head and jaw, and vice versa. And when you think about how we treat horses, so many times they rear and they hit their head in the trailer, or there's a fly on them and they hit their head and hit something in the stall. Dogs with some of the halties and head collars and things that we've used also, if they are turning to scratch or bite and hit their head on something, same thing. They can have a lot of injuries in the head. And I was working with a dog once who really needed cranial work, and she had had a television set fall from an RV and hit her in the rump. And all the vets said she was fine, but she had tremendous trauma to her sacrum from that injury. And craniosacral therapy is an effective treatment even for very old injuries. When I saw that dog, her injury was 10 years out, and we still had a huge change on her gait and her behavior by releasing that trauma to the sacrum. So those injuries can manifest as orthopedic issues and behavior problems. Part of why that dog was coming to me was because she was very nervous with other dogs.